You're good. Okay, cool, awesome. So my name is Mike Buchanan. I am from the VA. I am a veteran outreach specialist. You might know what that is?
You outreach to veterans.
I do outreach to veterans. You're right. Yes. Yes. I figured it was going to come from the corner with the Marine back there. So yes, I do outreach for veterans. Okay. So I am literally the first to get hired to do this job in the nation. The VA has always had outreach of some sort. You've probably seen them out at certain shows or events or veteran events that you've been to, but that's a part-time kind of gig, right? We're a full-time outreach service because Dallas is about to be the largest hub for veterans next year. So next year we're expected to influx almost by double the size of veterans that we have right now. It's going to get nuts, right? So in preparation for that, then this VA is already the second largest VA in the entire country. So in preparation, we needed someone to do outreach, okay? And I guess that just fell on my shoulders. I already had contacts out in the community, so wham, here I am, right? Now I'm back in outreach. Sweet. Nonetheless, I was Army. So I was U.S. Army for 7 years. I did 2 appointments to Afghanistan. I did OEF 09 to 10, and then I did 11 to 12. Anybody there 09 to 10? 11 to 12? We already talked about that? Yeah. Okay, cool. Awesome. Yeah, so Afghanistan was crappy. Anybody been to Afghanistan? Yes. It's terrible, right? Yeah. Anybody been to Iraq? Good for you. I wish I could have gone to Iraq. Afghanistan was awful. I would have rather big particle sand than fine moon dust sand. That would have been splendid. Yeah. So nonetheless, I was a 19 Delta Cavalry Scout. Anybody know what a Cavalry Scout? Yes. A lot of people actually don't know what a Cavalry Scout is, even though they were in the Army. So Cav Scout's pretty much like an 11 Bravo. It's like an infantryman, but we are in smaller teams. So infantry has 40 people. We have like 26 at max. That's maximum, 26. And that's not just, that's including like our PL, our platoon sergeant, our other leaders, okay, 26 max. It's nuts. We're the jack of all trades, master of none. Yes, that's right. We have to do everything. So, funny story, I was on a base one time, and I asked this infantry guy who we had kind of like sectioned off with us, I said, hey man, what ComSec fill are we on this morning? He goes, I look like a comm guy to you? And I said, no, but you look like a private, so I kind of figured you'd know what ComSec fill we were on. And he goes, ask the comms guy. And I said, you have a comms guy? Like, you have enough people to have a comms guy, right? So every one of us had to know everything. So I guess it just kind of goes in sync with my job. Now I kind of have to know a little bit about everything. So when you have questions at the end, ask everything. I will give you an answer, trust me. Some of them you will not like, okay? But I will give you an answer nonetheless. Cool? Great, let's get started. Okay. So this is going to be the PowerPoint. So sorry it's death by PowerPoint. It's all their fault, okay? So I'm kidding. They did ask for one though, okay? So PowerPoint's just to keep me on track, okay? So I know what I'm supposed to be talking to you about. Any kind of sidebar questions, cool? Just sling them, okay? As long as they don't have to do with benefits, I'm good, okay? Because there's a difference between benefits, but we'll talk about that in this next slide. Okay, so VA North Texas. Here's our 6 priorities of the VA North Texas. This is kind of a get to know the VA a little better, all right? So some veterans, most veterans think that they know the VA, but really don't know the VA, okay? Especially our VA, because once you've been to one VA, you have been to one VA. No VA is similar, no VA is alike. If you go to the VA in Fort Worth, it's totally different than the VA in Dallas, it's totally different than the VA in Grapevine, it's totally different than the VA in Denton, it's totally different, okay? Every single VA is totally different, but here's the one from Dallas. This is kind of we're the eye of Sauron. Anybody a big Mordor fan? No? Okay, with Lord of the Rings? Okay, we're the eye of Sauron that kind of looks all over DFW, okay, the Dallas VA. So these are our top priorities, greater choice, okay? So our biggest thing right now, our biggest priority is giving you greater choice as a veteran. Swear to God, I know it doesn't seem like it, but it is, okay? I know, it really doesn't seem like it, but it definitely is. So I was just talking to Jameson earlier today, the choice program. Everybody familiar with choice program? No? Okay, cool. So, choice program. Choice program was this program that Congress mandated, or Congress came up with as a kind of a stopgap or a boo-boo fixer, because there were so many veterans coming in, and we didn't have enough, I guess, physicians to fill all the amounts of appointments that all of you would need. Okay? It's really not that simple. It doesn't just come down to physicians. It comes down to space and availability. We may have the physicians, but we don't have the space Right now we're about 1.7, get this, this is gonna be nuts, okay, you ready? We are 1.7 million square feet under what we need to serve just the population that we serve currently today in the Dallas-Fort Worth area. 1.7 million square feet. That's insane, right? So, nonetheless, we wanted to give you greater choice. So the choice program was enacted, okay? Basically, if we didn't get to you in 30 days, okay, or if it was outside a 50-mile radius from you, if you were outside a 50-mile radius from the VA, okay, you could go to your local doctors around your area. Great program, right? Ha, funny, it already existed for like 30 years, okay? Congress just slapped a new name on it and made it more expensive for the VAs. Just as kind of like a shame on you, wag the finger, okay? So now that's gone. November 1st, it went away. There was a kind of another law or bill that got passed that took it away because TRICARE was running it into the absolute ground. Okay, so we took it back from them, and now we don't have to pay them 40 cents on the dollar, 47 cents actually on the dollar for all their services as a service fee, right? Now we pay 17 cents like we normally did, okay? But now everyone knows that it exists. So now there's no excuse. If it's more than 30 days, you ask for choice. Okay, you say, I want to go somewhere else. Choice me out, okay? If they say, your appointment's going to be 31 days, no, I want to go somewhere else. You have that option, okay? You definitely have that option. You should ask for that option. And we'll get to more of that later. But greater choice, okay? We're trying to give you greater choice. We are also in the mix of possibly buying 2 more hospital systems as well.
So will they send out a new card, or?
No, card doesn't matter, okay? The card that you got for choice, it's a good question, okay? Most of you got a card for choice. The card does not matter, okay? It's not like an insurance card. All it means is that you were on this list of already known veterans that you technically are eligible somehow. Either you lived outside the radius, or you have a doctor whose appointment scheduled is like 45 days at the least, something like that. So when it was first enacted, you just made this list that happened to say that you were eligible somehow, some way, okay? So they sent you this card in preparation. The whole system was so thrown together and so kind of thrown out there, no one really knew what world they were doing, okay? Because TRICARE, everyone that had TRICARE, you've all had TRICARE before, okay? We've never had a card, right? TRICARE is just like, here's my social, this is my policy number. That's my policy number, is my social with TRICARE, right? We never had a card. We never will have a card. Even now, there's still not a card, okay? So the whole card thing really threw people for a loop, okay? But that's all the card was. It just meant you were eligible at some point for choice, okay? So, greater choice. We're trying to do greater choice. So like I said, we're about to try to buy 2 new hospitals as well for Dallas-Fort Worth area, okay? We're going to try to buy one in Waxahachie. So, if anybody lives near there, Waxahachie? You do?
Mansfield.
Oh, that's a terrible drive. How do you do that?
I got used to it by this point.
Bless your heart, man. Bless your heart. So Waxahachie, we're trying to try to buy a hospital in Waxahachie, and Garland, we're going to try to buy a hospital in Garland. Hopefully, Baylor, Scott, and White are really nice to us, and they give us basically a charity draw for a hospital. Nonetheless, greater choice. Okay, modernized systems. So we have a new systems coming out for everything. So you know how I used to call the VA and no one would ever pick up?
Yeah.
Yeah? Someone really jumped on that. Who was it? Was that you? Okay. That's not going to happen anymore. Okay? So we just modernized our phones. Our phones are from like the 1970s. So each clinic had their own phone line and just that phone line. Right? You had this one phone line that literally rang in a corner and no one answered. That was the phone line all of you were calling for years and years and years. Because we should have modernized our phones a long time ago. Okay? But we're just modernized our phones. So now all of our phones are all linked together. So if one rings and it's unsuccessful, it rings to the next one. And if that's unsuccessful, it rings to the next one. And that one, and next one, and next one, and next one. Until someone picks up and takes your call. That's how it works. And it rings all the way down to the director's office. He's even got one of those phones too. So bless anyone's heart if it ever gets to the director before it gets to somebody else, because somebody getting fired tomorrow, okay? All right, so nonetheless, we're modernizing our systems. We have all sorts of things that would just blow your freaking mind. I swear to you, okay? It would blow your mind how many things we have right now. We have one of the only 3D, what is it? It's like a 3D virtual reality surgical suite kind of thing. There's only 5 of them in the nation, and we have 2 of them. It's nuts. Okay? Literally, a doctor can perform surgery on you, right? while they're looking basically at all of your organs in 3D and virtual reality. So they're looking through your skin and they're looking into what they're actually doing surgery on. It's just because they have goggles on. It's nuts, right? I mean, it's nuts. He can view in, he can like zoom in on the imaging and stuff like that. It's crazy, okay? It's totally nuts. But nonetheless, we're modernizing systems. Modernizing systems helps us do a lot of things, but it helps us give you better care. Okay, it helps give veterans better care across the board, right? Focus resources. So basically, we're trying to figure out what's affecting veterans right now, which is really good. That's why we have an outreach team. I get to go out and hear all of the people's complaints and my own complaints because I use the system exclusively, because I'm not going to sell a system that does not work, right? Or I'm not going to sell a system that I do not use, because that would be stupid, right? That would just be dumb. So, nonetheless, what is affecting veterans right now? We have a lot of things in the works. One of the things that we're working on right now is OIF population. There's just not enough of them in the hospital. Right now, we serve currently about 8 to 7% of the total population that live here in DFW. That's how many come to the hospital or just enroll. That's crazy, right? You think about it, it's pretty nuts, okay? Because you're talking about almost 200 to 300,000 OIF vets that live around here in the DFW. We cover 40 county area and 2 counties in Oklahoma. So out of all that area, you're talking about almost probably 200 to 300,000 OIF veterans that we're not serving. It's nuts. It's crazy. Too much. All right, so patient experience. We're working on this, okay, diligently. I promise. I know it doesn't seem like it sometimes, but we are, okay? We have a lot of different things in action for that one. Take it. So improve timeliness. So we're trying to improve your timeliness. Suicide prevention. This is the big one. You're always going to hear suicide prevention everywhere you go. Okay, it's even on the back of my business card. The suicide crisis hotline. This is just a huge one. Okay, the VA can't be there all the time. We just can't. Okay, neither can any other service that you go to out in the community. They just can't. Okay, so if you ever have a problem, Veterans Crisis Line. They're great. They're awesome. It doesn't have to be a crisis, by the way. Okay, cool. Good with this? Did I sell you yet? Don't seem convinced. Next slide. Okay, perfect. So here's the breakdown. This is important to know. Okay, this is important to know so that you can share this information and spread it like wildfire to every other veteran in the entire nation. Please. Okay, it'll help me get a lot of field questions. Go ahead.
Are we going to be able to get a handout of this at all today?
He has an email. Can you print this out for certain people or email it to certain people?
Yeah.
Okay, there you go.
Sure, anybody.
Jameson can.
I'll send it. We'll figure out how to get it distributed.
Perfect. So Jameson can work on getting it distributed. Absolutely, yeah. Please. Anything that helps you guys. If you need anything else after this, or any of these handouts that I have here, if you need more of them, please let me know, and I'll give you more of them. And we'll also be back at some point, hopefully. Yeah. All right, cool. So here's the breakdown to the VA, okay? Everyone always comes to me and says, hey, what about my benefits? I've been waiting like 15 years for my benefits. I say, okay, good for you, because I'm VHA. I'm right here. Okay, I'm VHA. I'm Veteran Healthcare Administration. That's what I do. Okay, healthcare. Okay, there's a VBA right here, benefits. Okay, that's what they do. The benefits people. Anybody ever had secret squirrels in their branch? Yeah, you know what I'm talking about. Okay, military intelligence. Yes, okay, there you go. Military intelligence, yes. I call them secret squirrels. They run around like everything's on fire all the time. Okay, and they're always hush hush and talking secrets, and then you realize that you're just talking about nothing and you could have known it anyway. Okay, so that's the VBA, okay?
I admitted to that.
Yeah, so the VBA is the same exact way, I promise you, okay? So they literally have one number for everyone, even for the people that work at the VA. We don't even have their number to their desk phones. It's crazy, okay? They're like the most locked down, secretive people you'll ever meet, okay? Because they don't want to be bothered. Because 85% of the questions, probably 90% of the questions that we get when we're out and about as VA personnel are benefits questions. Because I can tell you right now that most of your minds were in benefits before you even walked in here. Okay, 85% of you. All right, so benefits administration. I know a little bit about benefits, so please fire away. And if I don't, I'll send you somewhere I do know, okay? Or I'll send you to someone that does know. But nonetheless, veteran healthcare, we do enrollment for health services. VA benefits, they do home loans, education, disability claims. You have a central office. So central office is actually here in Arlington. Okay, so we have an Arlington branch office for the central office of the VA. Each office is kind of broken down into regions. So think about it like that, right? Regions, you have different, we have VISNs is what we call them, okay? But each one is kind of broken down into a region, and then the VACO is basically who gives us our top orders, right? The marching orders. So yours would be whoever your main headquarters building would be, okay? That's kind of our VACO. And then we have National Cemeteries and Burial Service. So every national cemetery in the entire United States and abroad, okay, we control. The VA does. But you didn't know that. I bet you someone in here did not know that, because I did not know that when I first joined the VA. But we do, okay? And all your burial services. So, and if you haven't set up burial services, do it. I know, like, you could be like super young, but just do it. Why not? Get it out of the way. Go sign up for it, okay? All right, cool. Next slide. All right, so here's some of our medical services. Mental health. Anybody ever been to mental health? Yes. So have I. It's fantastic. It's the best thing since sliced bread, okay? If you have not been to mental health as a veteran, you have done yourself a disservice. Would you like me to repeat that again? Yes? If you have not been to mental health and you are a veteran, you have done yourself a disservice. You should go to mental health, okay? We are different than everyone else that you will meet. We are. We always will be, okay? You might integrate very well back into society. Claps. Good for you, okay? But you still have something, I can guarantee you, underlying, okay, that the military has affected or done, okay, that you could receive help with. It's just mental health. It's not like they're doing brain surgery on you, okay? They're just talking to you. There's plenty of different ways to do it. So some of these different ways are, do I have it on here? I do not, crap. Okay, so the vet center. Anybody ever heard of a vet center? No? Okay, so a vet center. Vet center is actually VA, but not technically, it's weird. I'll explain it though. So back in the Vietnam War, okay, after Vietnam veterans came back, the government really screwed up. Okay, and just basically turned their back on all of them for a couple of years, and then eventually was like, oh, we're so sorry, we did you wrong. Okay, the VA said the same thing, but by that time the VA or the veterans from Vietnam already established a place called the Vet Center. Okay, where they were actually being veterans serving veterans who were in the war together, right? So that way they could say, take someone to know someone, right? Take someone screwed up to know someone screwed up, kind of thing. All right, and they only treated people that were from wartime. So actually went to Vietnam, right? Boots on ground in Vietnam. So after the VA said, okay, we screwed up, the VA said, listen, we'll fund it. Congress said, we'll fund the vet centers because it's a great idea, okay? We'll fund the vet centers, but we'll leave your records sealed in the vet centers. Yeah, most people don't know that, okay? So that means that the VA cannot view vet center records. We can't. Unless you give a release of information, just like any other private doctor, right? Unless you give us a release of information to see those records, even though we pay all their paychecks. It's nuts, right? It's like the coolest thing, though. Okay, the vet center is awesome. If you were ever going to start your mental health journey or a mental health journey anywhere, start it at the vet center. It's awesome. Okay, eventually, when you go to higher level of care, you're going to have to come to the VA anyway, because that's where your higher level of mental health care is at the VA. But vet centers not allowed to give out prescription drugs, not authorized at all. Ever. They never will be. Okay? There's no doctor that can prescribe any kind of drugs there. The only thing that they can do is outside the box mental health care. Groups, you know, I don't know, day trips, certain stuff like that, adventurous things. They cuss a lot there. It's fantastic. It's awesome. Okay? I always enjoy a good mental health palace that can cuss a lot. First experience at the vet center, funny story. I went into the Las Vegas Vet Center as an employee of the VA as a peer support specialist. I walked in there and I said, I'm kind of unsure about these vet centers because I don't really know what they are, right? And it kind of seems weird because it seems like you technically get paid by us, but you hate us. So it's like you're like the really, you know, redheaded stepchild of the family, you know? Like you're like the rebellious one, you know? Like the vet centers are kind of like the rebellious ones from the VA. So I was really unsure about them, and I was unsure about mental health in general at the VA because I was still new to the VA. And so when I walked in there, I heard this guy cussing down the hallway. He was like, MF this, MF that, blah, 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 blah. He was yelling and carrying on a storm. Everybody was laughing, everybody was cussing. And I said, who is that guy? I was asking this person that brought me in for an intake. I said, who is this guy? And they said, oh, that's the guy that runs all the vet centers in Las Vegas. I said, like, he's the director? And they said, yeah, he's the director. And I said, this is it. This is where I'm coming to get mental health. Right here, okay? So that's kind of a little taste of the vet centers. They're awesome. Nonetheless, we have a mental health access clinic. So if you ever have a veteran that you ever meet, or a friend of yours, or neighbor, or whatever, and they need help, send them to the Mental Health Access Clinic. It's a walk-in clinic. It's literally at the Dallas VA. Okay, we also have one at Fort Worth. So walk-in. SCI, we have spinal cord injury. If you are ever critically injured as a veteran, okay, and you are enrolled in the VA, and you are critically injured, spinal cord injury, let's just say, okay, you lose function to your legs, okay, we're gonna pick you up almost full time, right? Like 100%, because you've been critically injured, okay? That's one of the qualifying factors of having healthcare at the VA. It sucks that it has to get to that point for some people, right? But we do that, so hey, no worries there if something drops on you, okay? Just letting you know. All right, but we do have a spinal cord injury. We have one of the biggest in the nation right now. We have HCHV, it's healthcare for homeless veterans. It's a pretty big thing. Social workers, we have social workers to help you with socioeconomic stuff. If you don't know what that is, you probably don't have a socioeconomic problem, which is good. That's a really good thing. Okay, so VRC, it's the Veteran Resource Center, or the Veterans Recovery Center is what we call it at the actual VA. So Veterans Recovery Center is really cool. They have a lot of cool things to get people basically engaged into society again. There's some people, their mental health disorders have disengaged them and will consistently disengage them from society, like schizophrenia, stuff like that, right? And so this helps people who are diagnosed with schizophrenia and get back into society and kind of be as normal as possible, I guess. There's what their normal is, right? And then we have medical services. So, how to apply for benefits? Because everyone's going to ask me that question anyway, so I just included it on the slides. You're welcome. All right, so how to apply for benefits? Seek out a VSO. Anybody know what a VSO is?
Veteran Service Organization.
Marine. It's right here. I got you, man. All right, so yes, it's a veteran service organization or an officer, okay? Yes, seek one of those out. Do not come to the VA. I will say that to the camera. Do not come to the VA for your benefits. Okay, there you go. Do not come to the VA for your benefits. I know that, yes, I work for the VA and I'm just telling you to not go to the VA, but seriously, don't come to the VA for your benefits. It's not good on you, okay? I'm here to help you navigate a crappy system, because that's what it is, okay? It's a crappy system. We're getting better every day, but it's still a crappy system, okay? I'm here to help you navigate that system so that you have a better experience. Because the more knowledge that you know, the better your experience gets, and the better your healthcare gets. The better my healthcare gets, the better all of our healthcare gets, right? We're all the captains of our own ship. So, as that captain, I am telling you, do not go to the VA. The VBA is inundated with so many claims that they are going to just bust you through like you are cattle. You're going to get that cattle experience that everybody talks about at the VA, okay? But if you go to a VSO like Denton VSO, excellent people, they are. You're absolutely right, okay? And they're very home, like, they're very consolidated, okay? Which means that they stay in-house. A lot of their stuff that they do is very in-house, and they don't like to deal with other VSOs either because they don't want to taint the program that they have right now, which is great. Good for them, okay? I love them for it. But your VSOs are the people you need to go see. They know the ins, the outs, the whats, the whatnots, okay, and how to basically navigate you through an entire system right now that is completely changed. You can do a full claim in like 60 days now. I know, the silence, it's just, you can hear a pin drop, right? You're just in awe. I know that's what it was. I know it. I know that's what it was. It's not that no one was listening, but you're in just awe, okay? So yes, you can do a claim in almost 60 days now, okay? It depends on what the claim is, and it depends on how much evidence needs to be, given for that claim. But if it's something like fibromyalgia, well, you don't really have to prove that one. You just have to be overseas at a certain period of time. And bam, you have fibromyalgia. Anybody know what fibromyalgia is? Yeah, neither does any other medical person, because it's not real. Okay? Because it's not a real thing. It's phantom pain. It's basically what it is, okay? But there's a fun name called fibromyalgia. It's phantom pain. It's just in your joints. You just don't know where it comes from. It's just basically your nerves get excited, okay, for no reason. So, seek out a VSO to get your benefits. Seek out a VSO. All right, so each county usually has one. All the counties in DFW have one, okay? So Collin, you got Collin, Dallas, and Tarrant, okay? So those are the major 3 counties, okay? And Denton, you're right, and Denton. So all of them have a VSO, because if you have over a population of, I think, 55,000 people in your county, you are now required to have a veteran service officer in your county, which is great. I think it's a good rule. Thank you, Congress, for coming up with a good one.
Are you designated to a certain VSO depending on where you live?
Yes. So each VSO, wherever, if it's county, okay, so county VSOs are going to deal with just that county, okay? So wherever you live, search out your county's VSO. I guarantee you have them, okay? DFW is huge, okay? Search out your county's VSO. You can go to other VSOs, like other organizations have VSOs, like anybody ever heard of Wounded Warrior Project? Sorry, I bring them up a lot. I'm just most familiar with them. I use them. I'm an alumni at the Wounded Warrior Project too. They have a person that will help you with benefits. Okay? So other organizations, VFW does too. Okay? So there's Texas Veterans Commission. I mean, there's a whole bunch of different veteran organizations that will help you do your claim. Right? It doesn't have to be just the county, but the county ones are pretty good. And they're usually not so busy all the time, I guess. And they're cool people because they're like right down the street from you, wherever you live. Yeah? Go ahead.
So I live in Wise County, but I use the Denton
You use the Denton?
VA office because it's a lot easier for me to get there right
Yeah.
after work.
That's fine. Here's what I would do. If you're going to do a claim, you ever done a claim?
No, I need
Okay.
to do a claim. That's
So if
all.
you're going to do a claim, look in Wise County. Okay? You look in that county first and see if they have a county service office. Okay? If they do, go to that one. Because if you try to go to another one, they're going to say, where do you live? What's your address? And then they're going to say, you don't live in my county. That's what they're going to do. Most of them are doing that right now because there's so many people trying to do claims. Because of the expedited rapid claim process, everyone's coming out of the woodworks to do claims. Plus, I'm doing my job as outreach, which means I'm sending a lot of people to do claims. Right? So, yay on me that all of you have now gotten kicked out of your VSO offices if you don't live in that county. That's a cool thing. That's a good thing. That knows that I now know that my job is working. Okay? Go ahead.
Do you need to make an appointment or can you just show up?
Good question. Yes.
Both.
To both. Okay? So, usually. Okay? Usually to both. Okay?
Then you have to make a Friday, if you wanna come on Friday,
Yes.
you have to make an appointment. The other ones are walk-in, but it's better to make an appointment.
It's better to make an appointment always. It's always better to make an appointment because it's better to talk to someone because usually when you're going to call a county service office, they're always going to be busy. They just are. They're busy doing claims. It's okay. It's a good thing. So you're going to probably get an answering machine. You leave your name, you leave your number, right? You leave your information. I'm going to just try to start a claim, right? They'll get back to you. Most of them usually 24 to 72 hours, give or take, a day or two. Okay? So when they get back to you, that's when you really want to talk to someone. You want to talk to someone to make an appointment because you want to say, hey, what do I need to bring in? Because you don't want to come in and waste an hour or two of your life and you not bring the right paperwork. Right? I mean, that would just be terrible. Especially in Denton. Did you live in Denton?
Didn't count.
Okay, yeah, because I mean, like, driving anywhere around this place is... Whew, man, okay. Yeah, it's bad. So you don't want to drive anywhere unless you have the right stuff. Okay, cool? Does that answer your question?
Yes.
Perfect. Any other questions? No? No? Okay. All right, so they know how to word it, okay? You don't. Don't do your own claim. Don't do your own claim. It's not a good thing. Okay? You have to know how to word, unless you're a wordsmith. Anybody a wordsmith in here?
Jamie.
Anyway? Yes! You can do your own claim. Yes. Actually, no. You can't do it because if you do it with a crayon, it will immediately get turned around and sent back. Okay? So I'm sorry. I know I keep rocking. I'm sorry, man. The Marine Corps, man, it just... Okay. Yes. Here's the thing, though. Don't do your own claim. There's no purpose in doing your own claim, okay? Especially if you haven't done a claim already. Why would you go through all the hassle and all the stress to do your own claim? You don't know how to word things. You don't. As much as you may think that you do not. Okay? Because one of the biggest things that people don't understand is that no one cares that you're disabled. You want me to say it again? Because I know this throws people for a loop. This is the best. This is the best part, okay, of the speech. The whole best part. No one cares that you're disabled. No one cares. Okay? That's not what you get rated on. Okay? You don't get rated on what disability you have. You get rated on how does it affect the quality of your life. That's what you get rated on. That's what everyone at the VA cares about. How does it affect the quality of your life? Okay? If I have PTSD, how does it affect the quality of my life? If it separates me from my family, if it separates me from society, if it causes me to have job problems, family problems, kid problems, all sorts of different issues, okay? It affects the quality of my life, right? That's what people in this department, okay, care about. How does it affect the quality of your life? That's it. Everyone has back problems. Everyone. Everyone that was in the military shrunk 2 inches. Did you know that? Almost 2 inches. On average, it's about a quarter of an inch. It's anywhere from a half an inch, okay, in size, okay, to about 1.5 inches. We shrunk. You're compressed. All the weight you carried, all the stuff, okay? Everyone compressed. We all have back issues, but it's how does it affect the quality of your life now? Okay? Make sense? The VSOs know that kind of thing, so they're already going to word it like that. They're going to say, can you stand up for more than 6 hours? And then you're going to go, sometimes it hurts. Great, you can only stand up for 4.5 hours because it affects the quality of your life, okay? So then they're going to word it in a way that they're going to send it off, okay? And you're going to get claimed for it. That's what they're going to, and they're going to coach you too, okay? They're going to coach you on how to answer questions. Like this, when you move a muscle, like my arm is torn. I have a torn rotator cuff in this shoulder. Never going to get fixed, okay? Because I don't have time for that. Ain't nobody got time for that, okay? So I can still move my arm, and I can still drive, and I can still shift it into gear. I can still do a bunch of stuff, okay? I just can't lift it above this. That's okay, okay? I'm good with that, all right? For now, at least, okay? Until I have time. So here's the thing, though, is that if I move it here and I start to feel pain, right? Am I going to move it beyond here? I can, okay? Not smart. My body says no here. I should not take it further than a no, okay? That's what the VSOs are going to coach you in, okay? Don't take it further than a no, all right? Pain equals no. Cool? Go ahead.
Just one quick comment.
Yeah.
One of the things that I learned when I went to the VSO in Denton is they know how to do what they call a fully qualified claim.
Yes.
And the value of a fully qualified claim is that once that process is started, no matter how long it takes, if it's considered a fully qualified claim, then when they do grant that claim, it goes back to the date it was filed.
Yes.
And not the date that it was approved.
Yes, absolutely. Yeah, and a fully qualified claim, it causes you not to have so much conjecture when it's going through the claims process, okay? Fully developed just means that you have all the evidence that you need, and you don't really know what evidence you need, okay? They do. They know exactly what evidence you need. They have the big book, so does the Purple Heart Foundation. It's like a book. It's like this big. It's insane, okay? It's huge. All right, you can literally like kill someone with this book, okay? It's a disability book, and when you go through it, it just basically gives you what you should be rated for certain conditions and yada, yada, yada. A lot of these guys have been trained for a lot of years at these offices, and they know exactly what to put in there that either forces you one way or forces you the other way when it comes to claims process. Let them fully develop your claim. Good on this? Go ahead.
So like why?
The answer is no.
Okay.
Okay.
Perfect. Like I'm told 130% when they have rated today.
Okay, let's talk about that real quick because that's a really good question that usually comes up, okay? So he says he's 130%, right? Okay, you're not.
Yeah.
You're not, okay?
Math.
Here's the way VA, it's not really VA math, it's called whole body math, okay? A lot of other disability agencies do it, okay? Even Social Security does this, okay? It's called whole body math. You can't be more than 100% of a body. So I can't give you more than 100% of a rating. So there had to have been a way to give you a certain math, there had to be math, right? To always cut the pie down, okay, of what's left to cut down, okay? So here's how the VA math generally works, okay? Is that if you get a rating, let's say your first rating is 50%, okay? That's your highest rating that you have on your disability, right? 50%. This is how it goes. You will get 50% right out the gate. Now you're at 50. Congratulations, right? And you're 50%. You get your first claim, your highest claim you will get first, okay? 50%. Let's say you add another 20%, okay? You're gonna get half, right? Because it's the second one, right? So you just kind of do like a slash, like a 1 and a slash, right? 1/2, right? You're gonna get a half of that one. Then the next one, you're gonna get a third of that one, and a fourth, and a fifth, and a sixth, and a seventh, and an eighth, and a ninth, and a 10th of whatever the rating is. As you keep going down the list, okay? As they get smaller and smaller and smaller. To where you're getting like 0.07% of a point, right? But here's the thing, is that even 0.7% or 0.4% can throw you over to a certain number, okay? They always round up, they never round down, they always round up, okay? So if you're at like, 84.9, I mean, you're gonna get an 85, and 85 is gonna round up to 90. So, congratulations, right? Right? I mean, but does that make sense? Does that math make sense? That's the simplest way to explain the math, okay? It makes sense. You can't be more than 100% of a, if there's a pizza, you can't just take more pieces that don't exist, okay? You can't, okay? So it's like, think of that. You're like a pizza. Is that it? I just refer to everyone as a pizza. You're welcome for that one as well. Okay, cool. So here's Dallas County Veteran Service. Oh, look, Denton County. Hey! Okay, so Denton County has one, Tarrant County, Collin County. You can go to the American Legion or the VFW. It's pretty good, right, on benefits? Any more questions on that? Did I cover them all? Yes.
So it's better to go to the VSO than as opposed to the American Legion or VFW?
So, if you want me to be honest, because I'm super brutally honest about everything, totally a fault of mine, okay? But it depends. It depends. If you have an American Legion post that you like, that you go to, that you frequent, and you trust them to do your claim, sure, great. If you have a veteran, if you have a VFW that you go to, that you frequent, that you trust them to do your claim drunk, I'm kidding. But if you trust them, then great, okay? Listen, they will do your claim, okay? They will. They'll do your claim, and they have people that are there to pay to do your claim, okay? But I'm always going to trust someone that does it full-time over someone that does it part-time. Okay? I'm going to trust a full-time employee more than a part-time employee.
VSO is officially part of the VA system, or not?
No. Okay, so it's a good question. Okay, so here's the thing. There's these things called VSOs and VSAs. Ask the person that is doing your claim which one they are. They will look at you like you have something growing out your forehead because they're going to be upset. Okay? Because if they're not a VSO, they're going to be really upset. Okay? Because you know the knowledge that I'm distilling on you, or giving you. Okay? Here's the thing. There's a difference between a VSA and a VSO. VSA can get trained by anyone. Okay? They go to this class, it's like a weekend long, okay? And then you can do claims. Yay! You did a weekend class. It's like being a realtor, okay? All right? You go to a couple weekend classes or, like 8-week course or something like that, and yay! You can sell houses, okay? So that's the same thing, all right? That's a VSA. It's called a Veteran Service Advocate, okay? That's a VSA. Now, there's a difference between a VSA and a VSO. VSO is Veteran Service Officer. Veteran Service Officer has to have like 7,500 hours of claims training, okay, and claims experience to be certified by the state which they reside in to do a service claim. And the VSOs have access to the VBA's database, which means that when you say, what's the status of my claim? And you go online and look up the status of your claim, right? The status of your claim is never going to be current that you can see, but it's always current on the VBA's database. So when you go ask your VSO can actually log into the VBA's database as if they worked for the VBA. So they get special privileges and access and all sorts of things. So that's why I say go to a county service office, because they at least have one that runs the office that can check on every claim. So if your claim has hiccups or if it's taking a while, they're going to be able to log right in and tell you exactly what's going on with your claim. And they have contacts, because they've been doing it for years. They have contacts inside the rating office and inside the offices in the different places that they basically go to get rated. Thinking like one's in Seattle and one's in Oklahoma, right? And so they have people that they know, physically know, inside of those offices that they can call, desk numbers. I don't even have that information. Craziness, okay? So, VSOs, not a VSA. They're going to be really upset. They're going to be like, oh, how'd you know? I'm sorry. Yeah, I'll just walk over that way, okay? All right, cool. So, here's some frequently asked questions. I'm trying to cover everything so that really you're left with no questions. But I hope that you do ask questions. I love questions. They're the best. All right, so I make too much money to qualify. Anybody ever heard this? I make too much money to qualify? So, yes and no. Here's the biggest myth that I want to dispel here, okay? The VA was established not for every veteran. That's a myth, that it was established for every veteran. It is not a safe haven of medical health care for every veteran. That is not the VA. That's never been the VA. Okay, that's a cultural myth, is what we call it, all right? So, let's talk about the actual VA. The VA in itself has always been established for service-connected veterans, period. That's what's been since the dawn of its existence, okay? Service-connected veterans. Since before even that, before 1981, all right, you just had to do 1 day in service, okay? But after that, they changed it. Okay, they changed it. Now you have to meet all these criteria. Okay, so we call it, you have to meet the veteran eligibility criteria, and then you have to meet auto eligibility medical criteria. Okay, one of those criteria may be money if you don't meet certain other auto eligible criteria. Like, let's put it this way. So I did 2 years of active duty, more than 2 years of active duty service. It makes me eligible as a veteran. That makes me a veteran in the United States of America. It does. Okay, there are certain things that don't make you a veteran in the United States of America too. Okay, at least according to Congress, not according to me, according to Congress. Don't shoot me, please. I'm a messenger. I promise. Okay, but according to our standards, the VA standards that Congress has set down. Okay, let's say like a National Guard member. Let's say you did 37 years in the National Guard. 37 years. Okay, and you were never on a Title X deployment, which means you were never sent by the federal government anywhere. Okay, for 37 years, not even one day. You are not technically a veteran in the United States of America. 37 years. Okay? It's crazy, right? It's craziness, okay? But a lot of people don't know that. But, too much money, okay? Yes, you may make too much money, but guess what the best thing about this is? The skeleton key to every closet in the VA, okay, is service connection. If you were even 0% service connected, you now have health care for the rest of your life. That's it. And the most that you'll ever pay in a copay, if you're less than 50% service connected, you're going to pay a copay. The most you'll ever pay for anything is $15. That's crazy, right? If you told someone else that, they would hate you. They would hate you just for having that, and it's free because you're service connected, so it's free, right? It's not like you have to pay to keep getting this $15 copay, right? Service like you do with health insurance. So some people ask me, this is not on here. Oh, it is on here. We'll cover that later. Okay, well, let's cover it now. So people ask me, like the Dallas Police Department, some of their people are getting to that retirement age, right? They're like, hey, all my kids are out, they're gone, right? They're older than 24 years old, they're not on my insurance anymore, okay? It's just me and my wife. My wife works as a nurse. She's gonna work as a nurse till the day she dies. Okay, so she already has that health insurance, and we just go off of her health insurance. So it's more expensive to have both of us on her health insurance because I don't want to use the cities because it's god-awful, okay? So can I just use the VAs and it be free and I take myself off? Absolutely. Why not? Why not? It helps cut costs, right? It's a great idea, honestly, okay? Great idea. So, yes, you absolutely can, okay? If you want to keep your own doctor because you have kids or you're supporting a spouse, yes, do that. Keep your own health insurance, okay? You can also use both. So I use both. I use TRICARE and VA. So sometimes when the VA lacks in services, I go to TRICARE. Okay? I use my TRICARE Prime. And then I go to a doctor in my local area and I say, hey, this is what's wrong. And they go, great, here's the medicine that's going to fix it. And I say, perfect. Then I go back to the VA and say, hey, this is what's wrong. And this is the medicine that's going to fix it. And then the VA goes, okay, I guess I can fill this medicine. And I go, perfect, thank you. And then I get my medicine filled for free. So I use both services. Why not? You're veterans, okay? You are deserving of these services. You are 100% deserving of these services. If you qualify for any kind of service connection, you qualify for the VA, you are deserving of services. Use the services to your greatest advantage. Use every service that's available to you. If you leave even one service, even if it's like painting with a twist for veterans, if you leave that service on the table, shame on you. Okay, you should have gone, at least just done one picture. Okay, go ahead.
And that works the opposite too. If the VA tells you something that you don't think, or you want to get a second opinion, you can take that to your
Yes.
regular doctor.
Absolutely. So great example. You're absolutely right. Great example, okay? So the VA tries to treat major causes of diseases and whatever, okay? So they're not looking at little intricate things. So, like for me personally, okay? For me personally, I was about 250 pounds, believe this, okay? I was about 250 pounds probably about 3.5 months ago. I weigh about like 190 something now, okay? So here's the thing though, the secret was I got a second opinion, okay? They're not looking for certain things because they're just looking for what's gonna kill me, okay? They wanna keep me healthy, they wanna keep me strong, but they're looking for what's gonna kill me. So they're not looking for the tinier things, the little things, all the time. Okay? You can get them too if you request it, but you need to be informed enough to request these things, okay? We're working on that process, okay? I'm working on some nonviolent protest methods. It's okay, yeah, get that on camera. Okay? Yeah, I'm sure that'll be a hit with the bosses, okay? But nonetheless, it's gonna take veterans to rise up, okay? We're in charge of our own healthcare. And if we all rise up about the same issue, let's say you got bad treatment, or there's always bad treatment at a certain clinic, and let's say 50 of us all walk in and we all go talk to the patient advocate about that same clinic on the same day, I guarantee you by the next day, that whole clinic is going to be changed. Whole clinic. Overnight. But the thing is that we can't get enough veterans to just go to the damn hospital, right? So that's the problem, right? Is we can't even get enough people to care enough about themselves to go to the hospital to get health care at the VA. VA you should always use as a veteran, even if it's once a year. Always use it. It's always your plan B, okay? Or it could be your plan A. You can get great service at the VA. You have to know where to get it, okay? And not every doctor is great. Some of them really suck. My doctor sucks. He's terrible. He's an idiot. And he cattles me through, okay? Oh, how's everything? It's not so good. Oh, great. Good to hear that. Okay, so you said, and I'm like, it's not so good. I'm bleeding from my eyes. And there's, oh yeah, no, it's great. Good for you. That's how, but here's the thing, is that I just go around him, okay? Because I know the system, right? And I know the system, and I just go around him. I don't really necessarily need him to do anything for me, okay? I need him to write some scripts. I need him to write some stuff, right? And send me to some specialty clinics. That's it, okay? Other than that, who cares, right? I'm just happy with whatever I get at this point, okay? All right, so I don't have any disability, so I don't need VA. Anybody ever heard this? Anybody ever said this? You said this? Oh, okay, listen. It's not a disability. God, I wish they would change this name, okay? It's not a disability. Don't think of it as a disability, okay? It's not whether you're disabled or not, okay? It's what the military made worse. Yes, the military made things worse. Okay, he's accepting. Okay, he's accepting in this. Fantastic. Okay, so that's what you're doing in claim one. That's it.
I've been out since '96 and never went to the
Listen, you're not the first person. I talked to this one person that's been out since 1965 and never been to the VA. I'm not broken. I'm healthy as a horse. And I said, you might be healthy as a horse, that's great, but hey, it's something that you're just leaving on the table. It's like you're like, oh yeah, I know that there's like $10,000 of healthcare sitting there, but like, maybe I don't need it. Like maybe, okay? And then you go 30 years and you're just like, I wonder how to get that $10,000 of healthcare back. And then they're like, hey man, there's not, okay? Because you waited too long. And sometimes you can wait too long. Sometimes, okay? Not all the time. We're gonna remove every barrier possible to get you in there. But don't wait. There's no point. It's your service. The whole place was created for you. The whole place was created for all of you. All of you are veterans. It was created for you. I like to remind civilians of that at the VA all the time. And literally, I get banned from places for reminding them of this. Like I just got banned from IT yesterday. Okay? Yeah, because I asked a question and they said, I don't know. I said, well, I'm going to tell you like I tell my kids, I don't know is not an answer. Okay, so I use an answer and then I'll go away. Like 2 weeks, 3 weeks, 4 weeks, the rest of my life, an answer would be nice, okay? So the thing is that people need to remember that, right? Is that it was created for us.
So basically, let's say I go in, do a claim.
Yes.
I'm at 0% because
Perfect.
I feel like I'm healthy.
Yes.
But what I'm in here today is because I'm getting a little older. What's that way? But I want to retire something.
Yes.
And like my wife is a nurse.
Yes.
She does okay. But and my kids are gone. Just
Look at
like
that,
your
see?
whole, yeah,
Man.
it's perfect.
Right on
Talking to me.
Jim's
Talking to me.
There it was.
But now I'm thinking, well, why couldn't I have the VA if I was retired?
Yeah.
Can I?
Yeah.
I can use it even if I'm at 0%.
Yeah. Absolutely. Yeah. Right now, if any of you are in the realm of retirement, even a year, 2, 3, whatever, use this realm of retirement age to do your claim and increase your claim. Consistently fight the system, consistently increase your claim, and it's basically like a ratchet. It just keeps ratcheting up, okay? Just ratchet it up as much as you can, or as much as you can take, okay, mentally, stress, just ratcheting your claim, okay? But you ratchet your claim until you just can't take it anymore, and then bow out and say, okay, I'm done, okay? And then when you retire, then you retire with disability and full health care. It's not a bad thing. Okay? You should have been able to do it. You should still do it. Even if you're healthy, you should still file a claim for anything. I usually say, do you get headaches? Everybody gets headaches. Yes, okay, you can get claimed for that. You can get 0% for that and then go use something for your foot or whatever. You're going to pay $15 to see the doctor and $15 for medication. So your total trip is going to be $30. $30. Go ahead.
So one of the things that I've noticed with the VA, they're,
All
first
lots.
time
I'm just-
the first time you get something on your claim,
Yes.
it seems like it's denied.
Or
Or you get 0%.
yeah.
So
So
I started with 0%.
okay. So did you do your own claim?
Nope.
You went to the service office. Okay.
Didn't.
So here's the thing. They just did not put in there, or you did not support enough evidence on how it affected the quality of your life. You presented enough evidence to say, yes, it happened during service time. If you fell off of a wall during, let's say you fell off a wall during basic training, okay? Let's just say, all right, you broke your foot. Okay, now you have foot pains all the time. Yes, you technically broke your foot, right? So it's service connected, yes. But let's say that you were in for the next 5 years and did 2 deployments on that foot. And then now you're getting out and you're like, no, I deserve 30%. Really? You know what I'm saying? You see what I'm saying there? So when they look at all the evidence, they're like, well, it didn't affect the quality of your life 5 years ago. Okay? Or for the past 5 years, it didn't affect the quality of your life. You were just fine enough to deploy. Okay?
I'm
If you're-
fat now, so yes.
okay, so but it's just about how you word it. That's it. Okay, that's all it is. It's about how you word it. Okay.
So
keep going back and providing more evidence.
that's what I was gonna say. Most
Yes.
people they just say, all right, I'm done.
Yes.
I'm tired of filling out this paper.
That's
Don't
right.
ever get tired of filling out those papers.
That's right.
Because if you do, I think that's what the VA wants you to do. Get tired of filling out those papers.
Yeah.
And just leave them alone.
I got 4 appeals pending, so.
Man, that'd be,
Yeah, I do too.
it's actually a really good idea. I should probably take that back to the hire. Why don't we just inundate them with paperwork?
That's
All the
what I
way.
think it is.
Okay.
for
No,
Don't
that's,
ever give up.
it's not really how it is. Okay.
'Cause I got denied, 60
Yes.
days later it came through and.
So let me be brutally honest, okay? 50% of veterans suck. 50% of us suck. We just do. I mean, it's how our family is, okay? 50% of our family sucks. And we suffer a lot of our things that we have in place that are bureaucratic barriers are because of the 50%. Okay, the people who have taken advantage of things, the people that have
I would
just
say
cried and
90,
cried
I
and
would say
cried.
90%.
You
The
say 90%. I'm gonna safely say 50%. I'm gonna politically correctly say 50%. So 50% of them suck, and it's really how it is. Okay, so if they ruin things for us, they just ruin things for us. Okay, and now we just have to kind of push on and keep going. Okay, and that's just the way that it has to be. It has to be that way. I mean, it was like that even when we were in the military. One person ruins it for everyone. Okay, that's how it always is. All right, everyone, when you go to the VA, no one really knows your name. You know what they do know? You're a veteran. But so are you, and 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 you. So if I do something, guess who did something that day? A veteran. But which one? It could have been any of you. Okay? It was probably you. So now I'm going to be angry at you. Or it was you. Now I'm going to be angry at you. Because you know what? You're just like the other one. Okay? And that's kind of where that mentality comes from, right? So we have to remember that as veterans, and we have to kind of be, I want to say, be on our best behavior, right? I try to be on my best behavior because I don't want to ruin it for the person behind me, right? I don't want to ruin that experience for the person behind me. So even if someone's being crappy with me, I try to be on my best behavior, and I go to the patient advocate, and I complain up a storm. It's fantastic. I love it. Patient advocates are like demigods right now. So in the VA, just so you know, if you ever have bad experience, patient advocate, go ahead.
So when you make your first claim,
Yes.
initial claim with the VSO,
Yes.
should I plan for a whole day, a half a day, or is this
Yeah,
hours of the process?
It depends on what you're claiming, okay?
Disability.
No, that's not what I meant. So, man, okay, so to be honest, if like for me, when I was claiming things, I had to claim PTSD, right? So because I did, I have it. That was the reason why I got medically discharged, okay? It's because like I literally could not function mentally any longer, okay? And I had to go to an inpatient hospital, actually here in Denton, okay? I got sent from Fort Drum, New York to Denton to an inpatient facility to help me with that, okay? So here's the thing though, is that if I'm claiming something like that, I have to write out descriptors about what gave me PTSD. And so to do that, I took like 3 days off of work because I had to go through all of my trauma basically all over again to put it down on paper because you want to overwhelm and overstimulate anything that you do.
Got it.
When you do a claim. Overwhelm and overstimulate so that a civilian goes, whoa, I don't want to read about someone missing a leg. Okay? So, and then they stop reading it and they're just like, screw it, just give the guy whatever he wants. Okay? So it's called overwhelm and overstimulate. The VSOs will talk to you about that too. Okay? They'll talk about overwhelm and overstimulate when it comes to certain claims. But if you have certain claims like that you're going to be claiming, you may want to take an extra day to kind of like, decompress. Okay? Because you may not want to go through all that and then come back to work the next day because you may not be all right.
So my experience at Denton, first thing you go in, they're gonna ask you if you have your medical records. If you don't, they'll file for them, and that usually takes a little while to get your medical records.
Almost a month.
Yes.
Sometimes
Is it okay to bring in a copy, or do they?
Yeah, if you have a copy,
If you have a
please
copy
do.
of this, and I would make a copy of it, because
Yes.
in this process, you're gonna have to send your medical records in.
I have a copy of my medical records always at home in a fireproof safe.
Exactly.
Always. Always. Because in case I ever need to prove any of my records ever again. Just,
Right.
you want your records are really important. Any medical records that you have, especially pre-military or military, a whole military career, are very important. Not a lot of veterans have those actually. So if you do,
You can
Like-
also contact the base you're at, the hospital, they'll give you copies. of
good luck.
I just got.
Yeah, I know. Some of them do. Some of them are really good. Some of them are really crappy. But he's right. Medical records. And then any other line, what's it called? That's LOAs? I don't know. It's for National Guard people. They'll know what it is. But, or LOD, a line of duty. Whatever. It's just like when you went to sick call. Okay, so here's the last thing that I really wanted to do, okay, is it shouldn't take you all day to go to an appointment. That's a myth, okay? If you go to an appointment, especially coming from, this place is just terrible to go anywhere near an appointment. If you have an appointment in Denton, it's not necessarily going to take you all day. Here's what takes you all day, okay? Is that if you have a good doctor, it's going to take you all day. If you have a good doctor. It really is. Because your doctor's going to be behind. Because they're not going to treat you like cattle, and they're not going to stick to the 30 minutes that they have for every patient, and they're going to take a little longer, okay, with every patient, which is going to put them behind, okay, which is going to make you wait. All right, that's what I always tell people. If your doctor is behind, it's because they're awesome. Okay? If your doctor is on time or early, it's because they suck. Okay? I mean, it is. It really is, okay? It's not like another business. It really is. That's really what it's like, okay? So, be glad that your doctor's taking a long time. However, yes, I know that it intrudes on your work time, okay? I would always say this. You don't necessarily have to take a full day off, but why not? Okay, if you can afford it. If not, take a half day. If you can afford it, okay? That's what I would always say. And just hold out just a couple more years, okay? Because they're about to make it federally mandatory that all employers give breaks off for veterans for healthcare importance. So,
I think we already offer that here.
just wait for that one. It's gonna be awesome. Okay, so here's the real quick. Just let me run through this. Future VA stuff that we're trying to do. Access to more veterans. If you guys have any opinions on that, later on, let me know. Access to large, spanning, veteran-friendly corporations. So we're actually trying to go to more places like this. Peterbilt, right? I did Lockheed Martin. They were pretty interesting. I guilt-shamed their CEO of their plant over there in Fort Worth to sign for the VA, even though he's like a multi-millionaire. He's like, I don't need a VA. And I was like, I know, because you're like a millionaire, but guess what? You're a bad leader if you don't. And he's like, oh, you're right. Okay. So, so anyways, we're doing more corporations and stuff like that because we realized that a lot of veterans got plucked from service and put right into a corporation. Okay, if that's what happens. It happens everywhere in major corporations. They pluck people from service and stick you straight into the work, okay? And then you think, oh, I'm a civilian now, I have to have civilian insurance, when you didn't, and now you've been paying out civilian insurance for the past forever of your life. All right, compiling more availability community resources for patients, evaluating public perception. I'm trying to change this one, but I cannot change it on my own. I need your help. I need you to complain about everything to the patient advocate. I need you to use the services and complain about the services as much as possible to the patient advocate so we can fix it, okay? I cannot fix it alone. Trust me, it's daunting. Give access to otherwise inaccessible veterans. We're trying to do that, dispelling myths and rumors. Other than that, any last questions? I know I took forever to do that. Go ahead.
So, I recently experienced the VA for the first time this year.
Was it great?
No.
Okay.
But I got a survey on the very first visit when I had no experience, so I'm like, I'm supposed to fill this out. I haven't even done anything yet. And she's like, oh, I haven't seen one since. I'd like to have one so that I could have complained. But
Sure.
they tried to set me up with an appointment, which was 3 months out. Then they called me back and said, since it's over 30 days, we're going to do Veterans Choice or something,
Yes.
or they said something like that. But they didn't let me go to my own doctor. They told me I had to wait till they gave me a doctor.
Yep.
And then by the time I got through to that doctor, it was the same date as the original. It took 3 months. And so I'm like, well, that was a waste of my time. I would have just accepted the first appointment, but they canceled that because I said, yes, I want to opt into the one and go faster.
So, all right, so let's cover this really, really quick, because I know I'm holding you guys over, and a lot of you have to get back to work, or probably get back to work. It's patient advocate, patient advocate, okay? Our patient advocates are, is this still rolling? Okay, cool, so I'll keep this PG. So patient advocates, a lot of our patient advocates are okay, pretty good, okay? Some of them, to be honest, are just not so good, okay? We have 3 of them that are teleworking. I don't know how you can telework as a patient advocate, but sure, why not? Okay, somebody bright and in charge approved that, okay? So here's the thing though, is patient advocates. Patient advocates in Trump's VA right now, okay, are like demigods. So they have the entire department designated for them to exist. It's called the Patient Experience Center. Okay, the patient experience and excellence, something, quality control, some long name that the Trump establishment came up with, right? So, but nonetheless, they now have basically direct access to everyone. So you put in a complaint with them, it goes to the service. All right, so the service chief or whoever, okay, gets it, has to comply within 24 hours to fix it. If they do not fix it in 24 hours, 24 to 48, I would say, right? They say 24 to 72, but it's really about 24 to 48. They don't fix it, okay, they have to give a reason why, and it goes up to the next chief, like the big chief, okay? And then it goes to the chief of like the entire service, okay? So like the chief of staff or someone like that, okay? Then it goes to them. They can't fix it, it goes to the director. So in less than a week, you could have your claim, you could have your problem all the way to the director, and then the director will call you and fix it. Happens a lot. There was one person that got billed when they were 100% service connected, and everyone was like, well, just pay the bill. He's like, I'm 100%. And they were like, well, just pay the bill, so go away. And so finally he said no, and it got all the way to the director, and the director was just like, no, the bill go away. And then he just clicked this button, and the bill goes, boop, goes away. So it does work, okay? It takes some time, but here's the thing: if it doesn't get documented, it never happened in the government. So if you get mad at something that the VA does and you don't get it documented, you have done a disservice to everyone behind you and yourself and your healthcare. This healthcare system is what you make it. So make it awesome. Don't color outside the lines. All right, awesome. Thanks, guys.
Questions? Ask them after.
Yeah, I'll be here afterwards, so you guys
We got you
will.
some Peterbilt swag.
Ah, nice.
Yeah, we got you a company keychain
Woo!
and koozie and hat.
Thanks.
So, for our first time, it was pretty successful.
Thanks, man. Thanks
Thank
a lot.
you so much, and we'll have you more, in the future events as well. And thank you all for joining the Veterans Affinity Group Lunch and Learn. And please make sure you sign in so you can get the training credits for this class. And again, thank you all.
Did you learn anything?
Thank you.